This is the Neuro Way to Practice podcast with Dr. Ted Arkfeld. In each episode, he shines the spotlight on patients who have achieved amazing results the Neuro way. Now, here's your host, Dr. Ted Arkfeld.
Neuro Way to Practice podcast. We have a special guest, and when I mean special, it's a capital S. Dr. Ryan Comeau of Kinetisense is with us tonight. And if you've never heard of Kinetisense, by the time we get done, if you're a doctor at Chiropractic, you're going to want to go purchase this thing and get on the subscription and start making a major difference in patients' lives. Dr. Comeau, thank you so much for being with us. I've got to tell you, I've been in practice for 36 years, and I have been fascinated with movement systems, and it goes way back to the early 90s. I was practicing in Phoenix, Arizona, and I saw this, I think they used it in the Olympics back then, where you'd put pointers, little dots on all the joints. And I was like, oh, that is so cool. Now, we flash forward to about 2014, and I'm from Lincoln, Nebraska originally, and I still have very good friends in the athletic department down at University of Nebraska. And so I take my daughters back. One of them is in a volleyball camp, and I'm getting a tour of all the athletic facilities. And they show this system, this movement system they have for golf, for baseball, for basketball. And I can't remember the name of it, but it was like $125,000. And let's face it, that prices it right out of the ballpark for just about every chiropractor. So we flash forward a few more years, and I'm in a rock tape certification program. And, back then we would have to do a squat analysis, and you're just sitting there eyeballing it. And then you got to have the patient do it over and over again, because you have to look at the different joints. And then I got into concussion work, and there was, I don't know if you're familiar with complete concussion management so they had a system that they wanted us to use for balance. I was like, man, it wasn't what I was looking for. I have no idea where I found out about Kinetisense, but from the moment I saw it, I was like, oh my gracious. And then for the subscription cost, it was a no-brainer. And so I have got to know, what was the genesis of the Kinetis system? What's your background and everything?
Yeah, no, and Ted, thank you so much for having me on your show here. It's quite a long story. It's a fun story. I love to tell, because a lot of people, wonder how a chiropractor from small town Alberta had this idea to create something like Kinetisense, and it like any idea, like any invention, we're trying to solve a problem, or we're trying to fill a gap that exists, and I felt that the gap of subjectivity and the lack of objectivity in the NMSK space was so darn significant. And as a chiropractor, as a profession that I think is so, insanely powerful, and we help so many people, I would ask myself, as I was going through chiropractic school, and then even after graduation, when I became a chiropractor, what is it that's limiting us from really, really being able to be a mainstream part of this healthcare ecosystem, really the go-to, because we are the experts in that NMSK space. There's no doubt about it. Mm-hmm. And what I realize is that, we're so darn good at treating our patients and helping them to move better, helping them to feel better, really improving the quality of their lives. But are we good at showing them that? Are we really good at showing them the change that we make? And I come from a family of medical practitioners. I grew up, my father is a retired GP now. I have 3 younger brothers that are medical doctors that are in different fields of medicine. And they have these diagnostic assessment tools. My brother that is in cardiology, he has these amazing assessment tools to look at, how his patients' hearts are functioning, whether it's a Holter monitor, or whether it's, other advanced imaging modalities,
Mm-hmm.
ultrasound, these different things that they can use. And when I was going through chiropractic school, I'm like, you know what? The practitioners that are in the NMSK space, so neuromusculoskeletal, that assess human movement, and this actually extends not just from the practitioner, but even to the performance coach, the athletic trainer, the kinesiologist, anyone that assesses human movement, we have nothing. And that really blew my mind. And to backtrack a little bit with how I got into the motion capture side of things, is that when I was in my undergraduate studies, I actually worked in one of those biomechanics labs. One of those, they're called Vicon labs, that have the 12 to 15 cameras that are set up in a room, and they're non-movable, and you have to put the black suit on with the reflectors, and it analyzes the body and gives you this three-dimensional data, XYZ data, all at once. But it took
Mm-hmm.
me an hour to take a patient through. It was absolutely arduous. And then the calibration time, having to set the system up. So fast forward to my chiropractic studies, when I'm in my last year of chiropractic school at LACC, and we're learning about advanced assessment. I said to the instructor, I'm like, so you're telling me that for complex movement patterns, because the body, we move, we're complex, we move three-dimensionally. That is, you talk about activities of daily life. Activities of daily life are three-dimensional. You're telling me that as practitioners that treat this, that we have to eyeball our assessments, or the best alternative we have is things like goniometers and inclinometers, which are joint specific, only really look at one joint at a time, and have been around for like 300, 400 years.
Mm-hmm.
So, it did blow my mind. So I went on this pathway of trying to enhance the chiropractic profession, trying to enhance the NMSK profession, and trying to give a portable biomechanics lab to the practitioner, to the trainer, to anyone that's assessing movement, and be able to show change. And not only has it really, I think, enhanced the clinical workflow of the clinician, or of the assessor in general, but the biggest change we've seen is how it affects the patient.
Mm-hmm.
And that's been just fantastic. So that's a long story short. I cut out a lot of pieces of that story, but that's how Kinetisense really started. And it was 10 years ago. We were the first markerless motion capture system that was out there. We used the Microsoft Kinect, and over the last 10 years, we've evolved, and now we can do all of this three-dimensional analysis with a single front-facing iPad, and it's all three-dimensional. So it has come a very long way, and happy to say it's being used across the world and by all different types of practitioners.
Well, you keep touching, you talk about neuromusculoskeletal, and I think a lot of times chiropractors forget about the neural part, and that's the program. And I'm not trying to sell the program, but I became very neurologically based. Not a carrot guy. I have a lot of respect for those guys, but I don't want to go that far. It really started with the rock tape certification, because a lot of people think rock tape, yeah, it's cool tape, and it supports, but it's all neurological, and that's really where it began. And then looking at the movement analysis, and so what I love about Kinetisense is, and first of all, it's part of our initial examination. I've used the JTech Medical, the little digital inclinometers. I don't use those anymore, because I would much rather have a patient move fluidly on their own in video capture than have these two digital inclinometers on them. And they feel maybe subconsciously kind of weird about that. But I can take and do the evaluation with Kinetisense, and I can get a real sense for the abnormal movement pattern. Now, I also take that back to a neurological basis, because many times they're moving away from the pain. So they're making compensatory movements. And we fortunately, about 4 years ago, right at the height of COVID, we had come across a direct current stimulation unit that really nobody hears about. It's called ARP neurological therapy. And it has been an absolute game changer for us. I have been able to move in and start doing a lot of post-surgical rehabilitation because of this unit. I never thought I would do that. And this is what I would love to see more chiropractors doing is getting into that rehab market, getting into that performance. You've talked about performance. I call it neurological performance. I think that's the goal that we've got to have as every practitioner to enhance the neurological performance of our patient. But you hit it right on the nose. If we don't have a baseline, and if the patient doesn't know that they're moving abnormally, because that's become normal for them, hasn't it?
Yeah, no, you hit a couple really important points, and I couldn't agree with you more. When we're looking at human movement, we have 30 different modules that assess different things. I mean, anything from posture to range of motion to then the more complex movements like clinical gait, where we can have someone walk in the clinic and we can assess their gait cycle, risk of Achilles tendon injury assessment, balance, you name it. But one of the I think really key modules in Kinetisense, we call it CAMS, which stands for the Kinetisense Advanced Movement Screen. It is a workflow of movements, 12 movements, that takes about 3 minutes to complete. And we take our patients through this movement sequence. And at the end of the movement sequence, it analyzes over 250 compensation patterns. Now, in a triplanar way. So we call this functional planar reactivity. How does that human being compensate in different planes to accommodate certain movements? And we things that, in compensations that the naked eye cannot really pick up that well. So over 250 compensations that we analyze in this movement screen. At the end of the movement screen, we then identify the joints that need mobility and the joints that need stability. Now, that's based on the movement screen. And then from that, we now have a global perspective of basically, how does this patient move? Where are their restrictions? So going from that global to granular to global perspective is so important when we talk about the clinical workflow that you're mentioning. We maybe have a patient that comes in and they have, let's say, right shoulder pain, and they have a problem maybe going into abduction and lifting that shoulder, and it's painful. But keeping in mind that some of these patients have had these ailments for months, sometimes even years, and it's actually altered their neuromuscular activation patterns of their entire body, right? You brought into you mentioned rock tape, the fascial lines, how skin, the proprioception and nociception, all these different factors of how we can affect how the body moves. Well, pain is one of those things that we as chiropractors, we do treat that. We treat movement dysfunctions, but are we really getting a global representation of that patient right off the bat? That's the key. And that can lead to not only the rehabbing of a joint if there is pain or dysfunction, but also teaches the patient, hey, I can actually really take a performance and functional perspective with chiropractic in this clinic. Even after my shoulder is fixed, it feels great. My doctor is reassessing me every month or every couple of weeks on this Kinetisense system, looking at how my compensation patterns are starting to shift away. He continues to treat those different areas that I'm compensating, and therefore improving my overall functional movement. So that's really the key, and you hit it on the head. The clinic of the future, from a chiropractic perspective, is really in the here and now, and it's having a portion of your clinic that is functionally minded and neurologically minded, that runs alongside the pain patients in the clinic. Whether that's a 50-50 or whether that's a 40-60, we can merge that together through really advanced assessment. And that's the beautiful thing, is when you incorporate something like Kinetisense, it automatically brings a functional perspective into your clinic. Even if you're, a chiropractor that's been doing the same workflow for years and years and years, it's so simple to integrate. And it really makes a big change to the patient flow.
Well, let's say that the typical chiropractor, and I almost hate to say that, but let's face it, they are there in the profession, and that's fine. That's their business decision. That's fine. to my way of thinking, they still need kinetisense because it enhances their examination, first of all. I mean, um, I used to do a lot of work in the compliance world and help doctors with audits and everything. And man, you've got the video right there demonstrating objective abnormal movements. The other thing that with the CAMS assessment, you get your percentage, you get your grade, and that's objective. And then the other thing, let's say that you just want to do adjustments. You do your CAMS assessment, and I tell you what, those blue dots are spot on when it comes to your palpation too. It's freaky. With our ARP neurological therapy, we do a thing called a scan to where we run pads across the muscle. We're looking to see where a muscle is broken down and cannot absorb the forces, and then that's where we need to focus our rehab at. You know what's really interesting is that I would say 95% of the time it's at the same spot of those red dots on the CAMs as the instability, because there's been a breakdown in that muscle or those groups of muscles, and they cannot stabilize that joint. And it's neuromusculoskeletal is pretty simple. If you take and you find the muscle that's not working, rehab it, then you can get that joint moving, and your neurological system will take over after that, and you're doing great. You know how I use the CAMs in so many ways, and I really like the CAMs Express now. You want to tell people about the CAMs Express?
Yeah, no, absolutely. So CAMs again was our first movement screen that we came out with. Again, looking at their neurology of movement in a different way that some of these other movement screens like FMS had looked at movement. Again, looking at that triplanar reactivity, compensation patterns, being able to identify and map that. Now, the CAMS assessment can take anywhere between 3 minutes to 5 minutes, depending on how much explanation you have to give to the patient if it's their first time having it done. But we wanted to also arm our practitioners with a shortened version of that movement screen that still gave a lot of information. It gives a lot of information, but that they could do in that 5-minute appointment. And that's why we developed CAMS Express. CAMS Express is simply a shortened version of CAMS, still gives amazing information, but takes about 45 seconds to complete. So now, even the 5-minute appointment or the 10-minute appointment, that shortened appointment, we can still do a functional full body assessment and fit that into the workflow.
Well, the other thing that I use with the system is we do a lot with the functional module. And so when I was doing a lot of concussion work, and even now, I make it part of our initial evaluation and with our rehab, if we're doing neuromuscular reeducation or therapeutic exercises. So what we'll do, like with the examination, if I'm doing a Seller-Beller examination, I throw the functional up. And so I'm having them finger to nose, eyes closed, finger to nose. And because they can't see themselves doing the sway or missing, they know they missed, but they don't know how far they've missed. And that's just valuable information to show them, listen, your cerebellum's not working like it should. And, maybe we need to do some things with that SI joint and with the lumbar paraspinals and the multifidus. And so we start doing all that work, and then we come back and we do the functional movement again. And all of a sudden they're back on, track. Powerful stuff. Great patient education right there. The balance. Oh my gracious. The balance I've used in our baseline concussion screening for the high school for years. And that is really amazing stuff right there, because you get the balance testing. Unfortunately, what I saw after COVID, everybody's balance was terrible because it was so sedentary. Nobody was using anything, and it just, I'm sure that you've seen that as well, right?
100%. There are so many different applications with Kinetisense. I mean, the concussion baselining is, and you think about how you can build your practice, right? If you're like a new clinician going out trying to build your practice, you start having teams coming into your clinic and you take them through the concussion baseline screen. It's the BESS test, the BESS test, of course, a modified version of that, but 3 different balance tests that are part of that. And baseline these kids, the power that has for that young athlete, for the parent, the teammates, you name it. You know, if a concussion does happen, they can come back to your clinic and you can reassess and show change. And normally there's like a 10 to 15 point change, even with the grade 1 concussion, because we know that balance is the most common deficit that we see with concussion. So it gives us another layer of being able to look at, you know, is this player able to return to play? You know, obviously also looking at their symptoms and different aspects like that. So it's super powerful. We actually have this cool new version of balance that we've been working on that is really neat, where we're doing balance testing, but having the patient put the cervical spine and rotate the head in different positions. Of course, this is a version of balance that's been looked at for quite some time in the neurological, you know, space. But how does that upper C spine, or positioning of that upper C spine, and this ties into subluxation.
Mm-hmm. Absolutely.
How does that affect proprioception, balance, you name it? And that is one of my favorite tests right now clinically. We'll put them on the Kinetisense balance test. We'll have them do a single leg balance, non-dominant leg, have them then rotate as far as they can down to the right. Check analyze their balance for 20 seconds, get them to do it to their left. All of a sudden, boom, they can't stand. It's unbelievable. And if we think about, you know, how that affects not only the individual with their activities of daily life, and I'm not even talking about concussed patients, I'm talking about the general population. But, you know, these athletes that need to be able to potentially, you know, rotate their bodies around that upper C spine because they have to keep their eyes fixated on the ball coming in, but rotate their bodies, golfers, you name it. And it's quite intriguing. And we see this in all age groups, even in our youth. And then, you know, again, clear the subluxations as a chiropractor, do the adjustment, and then redo that test. And it is astounding. It is absolutely astounding.
Because you're going to see the neurological system at its best then, and how powerful the adjustment is. And it's instantaneous too. I mean, that's the impact that we make. You know, you brought up the young doctor starting in practice. So like there's the concussion practice. And believe me, here in the States, there's just not enough chiropractors doing concussion work. And you do not have to be a full-fledged functional neurologist. Treating concussions, for the most part, is pretty straightforward. You know, you need some equipment and you need some additional training, but we can make such a huge impact in these kids' lives. But the other thing that I've seen, and I've worked for over 21 years, I was with our local high school as the team chiropractor, and we didn't have an athletic trainer. I mean, I did it all. And it has been the rise of ACL injuries in female athletes that is very disturbing. So tell the listeners about the ACL module, because this is can be a huge game changer.
Yeah, absolutely. You know, ACL, medial meniscal, I mean, we call it the terrible triad, of course. The MCL, medial meniscus, and ACL. These injuries are rampant right now, and we don't know. We don't necessarily. The research doesn't necessarily know why it's such an issue, but specifically in our female athletes, we know that they have a larger Q angle. Q angle being you know, that angle from the hip down to the knee down to the ankle. We call that the Q angle, and you know, women have a greater Q angle, in part because they have wider hips than males. And so that predisposes them to more valgus collapse of the knee. The other thing is that young females, specifically, as you know, adolescents that are in sport, especially if they're in sports where there's lots of jumping, you know, cutting, running, they're not as well developed usually as their male counterparts in the posterior chain. Our research is showing that they're more anterior chain dominant. So when we're looking even when we're looking at squat data, we actually see this, that the young female athletes, the adolescent female athletes, when they go into a squat pattern, they tend to have early anterior shift, patellar shift, or loading of the anterior chain in their squat versus their male counterpart. So because of that, they are quad dominant. They don't have as much posterior chain stability. They don't have as much femoral stability when they're cutting, when they're rotating, when they're shifting, when they're running, and that puts the knee at risk. And it was amazing, because it was about 10 years ago, there was research that started to come out that looked at hop patterns, so single leg hop patterns. And they found that you could actually, looking at the amount of valgus collapse that occurs in a hop pattern, and that torsion that occurs in the landing, we can actually look at risk of ACL injury, because that hop pattern, how they land, will transfer over into their sport, right? What is that stability at any given point when they land or when they take it? So that's what we've developed. We took that research, we took the parameters as to what was considered to be high risk, and in Kinetisence, you simply have your athlete do a little hop test, left leg, do a little hop test, right leg, and it'll automatically quantify what the risk of ACL injury is according to the normative data sets from the research and abnormal data sets from the research.
That's a practice builder. I mean, talk about separate yourself from the competition, and quite honestly, there's mostly athletic trainers, strength and conditioning coaches at the high school. They don't have this type of equipment. I've been pretty adamant, because I see across the board with some strength and conditioning coaches, and it's, it's not their fault. But I don't know if they're trained in movement analysis. And I get parents that bring in their middle school kids, and they're going, well, when can they start lifting weights? I said, well, let's do a movement analysis on them and see how they're moving. And maybe we just want to do body weight movements first before we start adding any loads to this, because then we're just going to reinforce compensatory reactions, and you're going to have breakdowns there. So, again, to the young chiropractor starting, or to any chiropractor that wants to have some fun in their practice, you get the Kinetisence, and there's so many ways to go. I mean, you can do the concussion, you can do the ACL, but the one that is really neat is the performance side, to where you can take somebody and you can just absolutely make a change in their life, can't you, Ryan?
Yeah, 100%. And I think about performance at every single level. So whether it's a young athlete, whether it's even a professional athlete, which we work with professional athletes, or even your senior that wants to golf, play pickleball, maintain their quality of life and their independence. I mean, really, at the end of the day, we're trying to allow our patient to be able to reach the functional demand that they have either in their day or their sport, and move their functional capacity to that level. That's exactly, I mean, that's what we should be doing in our practices, in a nutshell, really. Yep. is matching capacity to demand. And if we can identify what their current capacity is functionally, and that's what Kinetisence helps you do, then you now have a GPS to be able to get them to match what that demand is, and hopefully even surpass what the demand is. That's where you start to get into performance enhancement. Exactly. Reducing risk of injury in performance enhancement, but you have to have a tool to quantify the change along that journey. I equate it to when my wife and I first moved to Los Angeles, when we moved from Alberta all the way to LA, and we drove all the way there to start chiropractic school. We didn't have a GPS. They didn't exist back then. and so we were literally using a map. We had a map, it was out, it was in the vehicle, it was this massive map. And I don't know if you've ever been into, going through downtown LA and the overpass.
I've been there. Yep.
It is absolutely crazy. If you miss your turn, it's going to take you another 45 minutes or an hour to get to where you want to get to. So it's almost like chiropractic has been using a map or we've been using maps, and we're trying to, you know, think about different ways to get to that one location, or that the endpoint for that patient, or what their goal is, right? Where that capacity and demand is. But with Kinetisense, it's almost like you have a GPS and you can fast track that, because you can analyze every step of the way where you need to get them to go to. And also with the normative data sets that we're putting back in the system, we're going to be able to score that individual based on their age, their gender, their sport, right? Are they right arm dominant? Are they left foot dominant? But also their biomechanical anthropometric measurements. So that's the new thing that's going in, is we're actually going to score people based on the lever arms of their body. That's never been done before. So
That's exciting.
now I can tell that person, hey, you know what? You scored a 75 on CAMS, and your population that are at that level that you want to get to are scoring an 85. And here's the areas that we have to work on from a mobility standpoint. Maybe it's, you know, joint manipulation paired with stretching, and then also the activation part, where there's the stability piece, which is maybe rock tape or ARP, or any of these different techniques, or exercise rehab. Here's how we get you to that level. And by the way, we're going to check you along the way and show you how we're moving towards where you want to get to from a demand perspective. That's really powerful. And we have to remember how powerful that is for the patient, the client, when they can actually see change and they're actually being quantified. It changes the whole dynamic between your interactions with that patient, their compliance with buying in. You know, it's unbelievable. Even after we clear up their pain, that's the key. Is that Kinetisense practitioners are finding that they'll fix, you know, someone's shoulder, they'll get the pain to go away, and these patients are coming back every couple of weeks or every month, because they're like, doc, I got to get re-screened. I have to see if the corrective exercises you're giving me now are moving me in that right direction, or if I need to modify anything. And that's the practice that I want to be part of. I mean, that's a really, really powerful practice, because now you're enhancing functional, you know, movement. You're keeping them moving, you know, in a non-compensatory way, and that's how you change their life, really, because you're preventing that breakdown. And clinics that do that, usually they can't even take new patients anymore, because they're so darn busy. They're adding that whole other element to the practice, and it's really exciting.
Well, that's the number one thing patients want to do, and especially the geriatric patients. You know, they want to move. They want to move better. Everybody wants to move better. And like you said, the Kinetisense gives you that ability to demonstrate that. I mean, I've seen it over and over again in my practice. Technology is finally catching up with chiropractic, or should I say chiropractic's catching up with technology. It's so neat what's happening out there. And doctors of chiropractic, they got to get on board with this stuff. I mean, because there's so many neat tools, and we've got to all become movement based. I mean, and see, that's a thing that's
we always have been. And sorry to interrupt you, Ted, but we always have been. We just didn't see it that way.
Right.
We chiropractors are the movement masters. Like we truly are. But we need to realize that, like, subluxations are not just, you know, joint specific. We have like planar subluxations. If that makes sense. We can be subluxated in a plane of movement. And that's that neurological part that and imagine that we can actually map someone and say, you have movement subluxation here, you have a movement subluxation here. It tells you what plane, and then we go in and actually palpate and then apply, you know, the beauty of the adjustment to that segment, just like how you mentioned, and then have this map of where to go and start knocking these movement subluxations. I mean, some of the best users of Kinetisense, Ted, are the chiropractors that are considered to be very old school, that have adopted it. The guys that have been practicing for like 50 years. these guys are the best users of kinetisense because they see it. Hey, I'm just going to get a movement subluxation mapping of your body, and I'm going to attack those regions. And that's all they do. And it's so darn powerful.
Well, it makes practice fun. I mean,
Yes.
that's what it should be all about. It should be fun, and that you're making a difference in patients' lives. And this is a tool that can absolutely get you there. Oh man, Ryan, we could go on for another 2 hours, but I'm not going to keep you. But I got to have you on again sometime. I mean, this has been so much fun. I'm going to give a shameless plug here. I've got it scrolling down.
Thank you, Ted.
Guys, get a hold of the folks at Kinetisense. I can personally attest that the customer service is second to none. It's been unbelievable. You have always assembled an amazing group, and I absolutely love working with you. So, okay, I think that's pretty much it. I appreciate so much you being on, and we'll look forward to get you on again and talk more about movement, because that's a big topic.
God bless you, Ted, and thank you for having me. It's an
You
absolute
bet.
pleasure.